So our guest on the show today has always been a healthy guy. He felt good, he had no family history, and he had no symptoms. So following a routine wellness check, it was definitely a shocker to find out he had to go see a urologist, and then ultimately finding out he had prostate cancer. Now, many men prefer to keep their health concerns to themselves, not sharing them with anyone, but not for our guest today. Legendary sports host Vic Lombardi has made it his duty to share his story and encourage men to go get checked. He has been able to utilize a platform of over 80,000 followers on social media to be an advocate for men and their health. You'll definitely want to listen in to hear Vic's prostate cancer journey today. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. It is an honor to have joining us today on the Prostate Health Podcast, prostate cancer survivor Vic Lombardi. Mr. Lombardi is a legendary sports, television, and radio host. Since 2016, he has covered professional sports in Denver, Colorado for Altitude Sports. He has more than 25 years of experience in the sports industry and is a 32-time Emmy Award winner, 16 for Best Sports Anchor, and voted 2018's Colorado Sportscaster of the Year. He is also the co-host of the Altitude Sports Radio Morning Show. He went public with his battle with prostate cancer after he was diagnosed February 1st, 2019. He continues to use his celebrity status to help bring awareness to prostate cancer and encourage men to get checked in order to help spot the disease early. Vic, welcome to the Prostate Health Podcast.
Doc, thank you very much for what you're doing, and you're flattering to hear you use the word legendary. I take a step back when I hear that because it doesn't fit my role, and it almost makes me feel like I'm old and ready to go. So thank you very much. I appreciate it. Very nice of you.
So how did your prostate journey begin?
Well, like many people that are considered young for the disease, and that's the one element I hope that through the course of this podcast, we educate what young is. I don't know what that term means when it comes to prostate cancer anymore. It's always deemed an old man's disease, right? Oh, well, you have prostate cancer. That's the good one. That's the kind that the 70, 80-year-olds get late in life when they can't pee anymore. You're fine. Well, I found out I had prostate cancer when I was 49 years of age. And to me, that's still young. I don't know. Maybe I'm very subjective when I say that. But I walked into the doctor one day on my annual physical, and it was a little later than normal. I get one usually every year. This was 14 months after the fact. And my regular doctor had retired. My normal physicals had been very easy to go through. Hey, how you feeling? Let's do a quick blood test on this and that. Everything's good. Great. Well, because my doctor had retired at the time and I had a new doctor come through, she suggested, why don't we add a PSA to the mix since you're approaching 50? And I didn't even know what a PSA was. Okay, I'm in the television business. For those of us in TV, a PSA is a public service announcement. So I thought for a second, wait, you want me to do a public service announcement for my physical? I don't understand what we're doing here. So, all joking aside, I did the PSA, I did the blood work and all that. And then a couple of weeks later, I got word that I've got to go see a urologist. One thing led to another, and boom, there's cancer. Without that trip to the doctor, without that specific doctor calling for a PSA, without all the dominoes that fell, I'd probably be in a bad situation right now, considering how aggressive my cancer was.
Yeah. Okay, so, backing up just a bit, so you get the news of the elevated PSA, which, really kind of caught you off guard. Now, were you having any sort of symptoms at the time?
No, and that's what's awkward about this, is I never had any symptoms. No pain, no urinary issues, nothing outside of the norm. The weekend warrior type, lower back, and I'm doing this and that. Sometimes I feel like, I pull a muscle here and there, but never anything in the abdominal area that made me think that I had some cancer. And nothing. So it was just completely out of the blue. non-symptomatic, no family history. It just happened. And that's when it became important to me when I found out that it can happen to me just out of the blue. How many other men out there are carrying the same symptoms when they think they're completely healthy? I guarantee it's much more prevalent than we all imagined.
Yeah. Now, you have also openly talked about a medication you were taking at the time when you had your initial PSA level. Can maybe expand to our listeners about that medication and what they need to know when interpreting a PSA level?
Yeah, and this is where it gets layered. For those who, I did a lot of research on it, talked to a lot of doctors, and I think you understand where I'm going with this. A couple things. About a year before I was diagnosed with cancer, I was doing, I'm a radio talk show host in town, and I did an endorsement deal with a local provider that pushed testosterone injections, okay? And I went in and they said to me, hey, do you want to do a low T type of endorsement thing? And I was like, well, what does that even mean? What do you mean? Well, we can put testosterone pellets in you and you get a quick, energy hit. How you feel energy-wise? I go, when you're a weekend warrior, you always want more energy. When you wake up at 5 a.m. and go to work every day, you always want more energy. So if you're asking a guy, hey, do you want more energy? I think the answer is always going to be yes. So I was asked, do you want more energy? Yeah, okay, give me one of them pellets. Give me one of those pellets in the butt. Let's go. Little did I know at the time that carrying cancer, that was 5 months before my diagnosis, that a testosterone injection is probably the worst thing you can do. All right? It just flames. It fueled the fire. And when they did their PSA exam, my PSA exam there did not come back with any red flags. Now, there's a reason for that. I had been on a drug called finasteride, that is simply a tool to keep hair on your head, right? Many men take it. For me, my brother was taking it. I'm in the broadcast industry, the television broadcast industry. I have no issues going balding. I did it more as a precautionary measure. I don't want to lose my hair. The older I get, sometimes chunks of hair fall out. Let me take one of them there finasterides every other day and make sure I don't lose my hair, right? Yeah. There was no reason for me to take it. I just felt there's no harm in taking it, ever any harm. So I kept taking it. Well, little did I know, again, and this is where the education process comes in, that finasteride serves as a masking agent for PSA. I didn't know that. Nobody told me that. I didn't even know what PSA was. So I wonder, had I not been taking finasteride, if my PSA would have been inflated or shown inflated much earlier, and had they caught it earlier and maybe taken a different measure. I don't know. Those are all question marks. Yeah. But I had 3 things going against me. Number 1, no symptoms. Number 2, a masked PSA. Number 3, testosterone that suddenly just fueled the fire. Mm-hmm. All 3 in a span of 1 year.
Yeah. Oh, and that's, great points all the way through there. And, for our listeners, with that, finasteride, it typically reduces the actual PSA number by about 50% within that first 12 months of taking it. And so we really kind of double that number typically when we're, interpreting that PSA level. And so, like you said, it can kind of mask that, it was quote unquote normal, but without that kind of factor of 2 taken in, it maybe wasn't normal looking back. And so now you're off to see the urologist. He chats with you about the PSA after the prostate exam and discussing options. How did you like to proceed at that point, with that elevated PSA?
Yeah, and that was the other factor. The doctor, the urologist, they all realized my situation at the time. I explained everything to them. But when you go through the digital tests, obviously that will pretty much be the fail-safe plan. Is this it? Do you have a node on your prostate? Mm-hmm. Well, the first time I got tested, they couldn't find anything. In fact, the reaction was, nice, small prostate. Doesn't seem like an issue to me. I'll never forget the talk I had as I walked out of the office with that doctor, that urologist. I think that might just be an alarm that sounded that is all going to be good because you seem like you're fine. But in just in case, let's do another PSA test, right? That was the conversation I had. So I left the urologist's office that day thinking, oh, okay, everything's great. Well, then I get a call back, wait, your PSA just rose again. We didn't feel anything, but your PSA rose again. So I went back, got another digital exam, and clearly, as you well know in the business, sometimes the digital process doesn't always work best because the tumor is on the other side of the prostate. You can't feel it properly. It was a very small tumor. It did not encompass most of my prostate like some people do, but it was small and aggressive. And we went ahead and determined, man, this is, given the Gleason score that came back after they did the biopsy, they asked me after the second PSA, hey, we should probably just go ahead and do a biopsy because I don't trust these positive PSA scores continuing to go up. And I said, more power to you. I don't care. Biopsy me. And in my whole, I don't want to scare anybody out there that's listening to this podcast or wondering what it's like. But during the entire process of surgery, RP, all that stuff, I think the toughest obstacle was that biopsy because it's also new. You never had anybody do anything like that to you. And I'm not going to say it hurts. It's just uncomfortable. Yeah. And it's just invasive. And it's just like, what is going on here? So the biopsy was sort of a shock to the system. But once they got fragments of that prostate and they got to send them to a lab to give me an accurate account of what was going on, and then I got that phone call a week or so later saying, listen, you have cancer, and it's an aggressive cancer. That changed everything. Wow. Because up until then, I thought I was free and clear.
Well, certainly devastating news. Now, what was your initial reaction when you received the diagnosis?
I was still sort of numb, thinking that this can't be real. Again, I have no symptoms. I feel great. What are you guys talking about? This cannot be cancer, let alone aggressive cancer. And at that time, we had settled an appointment with the doctor to come talk about it, and got the chart in front of me talking about Gleason scores. I knew nothing about Gleason scores. I knew nothing about PSA value, nothing. But when I learned that my Gleason score meant there was a very aggressive cancer, initially an 8 Gleason score that became a 9 upon the pathology post-surgery. So it was much more aggressive than even the previous pathology had given us. I knew nothing about the nature of my cancer, so I was still in that numb stage. But the more days went by, and as soon as I scheduled my surgery, and the more I read up on it, they tell you, I'm sure you tell your patients, you might want to educate yourself, but don't over-educate. Don't lean on Google as the end-all, right? Because it can be very dangerous. I'm a journalist by nature, so to tell me not to go investigate and read about it is pretty much a lost cause. I spent every waking hour reading about my situation, and that led to, I think those were the dark days for me, because that's when you can go spinning.
So, you ultimately chose surgery, but, kind of looking back at, the options presented to you, kind of what kind of influenced you in terms of, picking that treatment option, or is that kind of just the one that seemed like that was going to work the best for you?
I'm an A personality. I don't believe in waiting around. I was given a couple options early. My original option was maybe sit back, throw some hormone therapy at it, and participate in a clinical trial down the road. That was an option. The other one, of course, was surgery. I didn't even consider the clinical trial an option. I'm not waiting around.
Yeah.
I have an aggressive cancer in my body. I want it out ASAP. And there was no option. There was no let's wait and see. And frankly, to each his own. For those who are patient and want to ask around and want to observe, and to me, the end game was easy. I didn't need my prostate to live. I've had a great life with a family, 3 kids. I didn't need to procreate anymore. So I wanted to make sure that I beat this cancer down as fast as I possibly could. So surgery was the only option as soon as I heard it was there.
So can you tell our listeners a bit about the recovery process with that experience in terms of surgery and some of the steps that were involved in follow-up?
Yeah, my diagnosis, my biopsy, and my surgery were pretty close together. I got the first available window for surgery. I remember I was diagnosed on a Friday. Perhaps it was 3.5 to 4 weeks before my surgery, which is a quick turnaround.
Yeah. Very
quick turnaround. But I wanted it that way because I just wanted to get it out. So I had surgery on February 28th of 2019. That was my surgery date. And I went to the hospital. And it was pretty easy. It was the best 4 hours sleep of my life. You go under. Dr. Maroney at the time, who I became very comfortable with, just assured me that this was going to be fine. And he was impeccable and thorough in his approach. He told me, given the Gleason score, that they were going to be extremely thorough. And during that surgery, not only did they take the prostate, but Dr. Maroney took 31 of my lymph nodes. And that was to ensure that it had not spread. As you well know, the most important part of that surgery is making sure you get it while you're in there. Yeah. So not only did he get it, but he went around to surf around and make sure that it didn't spread to lymph nodes. When I got the pathology report back a week later saying that they all came back negative, no spread, no margins, that was perhaps the greatest news I'd gotten since the birth of my kids, right? So that made me feel good. The surgery itself, you wake up, you feel a little sore, you're extremely hungry, and then you spend the next few days learning how to walk again because it's just a weird, your midsection. I play a lot of sports. I run, I cycle, I play basketball, I golf. I'm just not used to having my midsection feel so flimsy. And so I had to relearn the process of walking. I also had a great deal of bruising that took place. Some people react differently. Some people, you just have a couple holes in your belly and you're fine. Well, what happened to me is I had a couple puncture wounds, but because of the lymph node removal, I had bruising all the way up to my breastplate on my left side, like bad bruising, as if I got involved in a boxing match and kept getting shots to the ribs. That didn't hurt. It just looked bad. So I'm in bed for a week, in and out of bed, learning how to urinate again. That was mentally the toughest part of it. And a month later, after going through the process, doing my Kegels, reading about how to overcome this, I think it took me a month to return to normal.
Yeah.
I still have bouts of, urinary issues occasionally here and there. I'll leak, but I feel better than I ever have. I just don't have a prostate.
I know a lot of guys, there's a lot of anxiety surrounding having the catheter in the bladder and having that taken out. Can maybe talk a little bit about, what it was like to deal with the catheter and get it removed. And I think that definitely leads to some stress leading up to that.
Yeah, I'm not going to lie about it. The catheter is no joy, right? You're walking around with a tube in your nether regions, and it's your only way you can urinate.
Yeah.
And then when they remove that tube, you have to suddenly learn how to urinate all over again because that was your outlet. I had no issues with the catheter beyond just the inconvenience.
Yeah.
I carried that bag around with me. Heck, I went to my daughter's gymnastics match carrying that bag, embarrassing ever. He's like, what are you doing here? Like walking around like it's my briefcase. But I've never wanted to be embarrassed about stuff like that. It is what it is. The post-catheter events were tougher than the catheter events. Catheter involves a little pain here and there, but when you remove the catheter and you have to learn how to urinate again, mentally, that was tougher than the physical process of carrying a catheter.
Yeah. So now following treatment, what can a man expect in terms of follow-up and monitoring what you've been kind of doing so far?
Follow-up's fairly easy. Follow-up is a mental game. There are those who go through RP, you go through surgery, and as a precautionary measure, you go and have radiation treatment as well. My doctor, Dr. Maroney, he and I have decided to not go that route as long as I'm doing well, as long as my PSA numbers come back undetectable. We believe together that, why go and radiate the pelvic floor when we don't know what we're radiating? Exactly. There's still a lot of science there, right? Yeah. There's still a lot of pros and cons. I had a good friend of mine who had a similar score that I did at a similar time. He had a Gleason 9. His doctor suggested otherwise. He went through and did, a full schedule of radiation treatment right after surgery. And we decided, I don't know if it's to each his own again. I decided, no, I'm going to just, when I need radiation, if I need radiation, hopefully I don't, you never know, hopefully, that's when I'll go and do it. But in the meantime, I'm going to live and live by every PSA test. So now you ask, what happens now? Well, you eat well, my diet's different, and then you wait for that PSA test every 3 months. Some would suggest, well, why are you doing it every 3 months? You can do it every 6 months or every year. I'm a type A personality. If I had my choice, I'd take a PSA test every day. But my next one is coming up. We're taping this on a Saturday. My next one is on a Monday in 2 days.
Yeah.
So my anxiety levels go through the roof on the days before. You wait until, you go in there, you do that blood test, you sit by your phone, and you get onto your portal, and your portal will have the results within an hour. And you sit there for that hour going, please be undetectable, right? Please be undetectable. And then as soon as you see that undetectable, it's as if you have a new lease on life. And then you wait till the next 3 months. Yeah. And that's how it is.
Yeah. Well, thank you for sharing all that. And now looking back at your prostate cancer journey, do you have any advice for men and those that care for them?
My advice is be proactive. You went through this. You're going through this. The doctors are doing their best. But you have to add something to the equation. Okay, so you had your prostate removed. You had your prostate radiated. You're taking whatever medication. In my humble opinion, you have to still be proactive. exercise and diet, you can't do enough of it. Why wouldn't you give your immune system, why wouldn't you give your body the opportunity to fight this off? And I don't think going back to whatever life you were leading before, not to say it's a bad one, but eating whatever you want, not exercise, that doesn't help your cause. If anything, I was very active before prostate cancer. I'm still active, but now I've added the diet equation. Yep. I ate, doctor, before I had prostate cancer, I ate whatever the hell I wanted to eat because I exercised a lot. Yeah. I would live at Taco Bell. I would put pounds of sugar into my coffee. I would do anything I wanted because I felt I could. Well, now I'm learning that lesson that diet impacts health. Like it or not, it just does. So I've changed my diet.
Well, and good for you. And, just sure as your urologist has told you too, and, just like what I tell my patients is, what is healthy for the heart is healthy for the prostate. So, yes. Commend you on doing that. So,
yes. And, it's harder, exercising is easy. You just get through it. Eating right is the hardest thing I've ever done by far. Very hard.
So now, in addition to your own prostate cancer battle, you've been an outstanding prostate cancer advocate for other men. And one of the activities I know you've been involved with is the Gimme 5 campaign. Can you tell our podcast listeners a bit about that campaign?
Yeah, it was an effort on my end to get men off their butts and get checked, especially men in my age group who, again, we all feel like warriors, like we're, easily get through any health issue that comes up, or we just don't pay enough attention. So the Gimme 5 campaign was an effort to get 5 of your friends, 5 of your family members, 5 people that, you hang with. Hey, go get a physical. And when you're at that physical, ask them to do a blood test. And it doesn't have to be just a PSA. This isn't aimed strictly at prostate cancer, but go get checked. You have insurance, and those of you who don't, make the effort. Whatever it costs to get that physical, go get it done, because that cost is nothing in the end. If you can find a symptom of a disease like they found mine out of the blue, why wouldn't you take that opportunity? Go get checked. That's what Gimme 5 is. Get 5 of your friends, tell them to go get checked for whatever issues they may have.
Well, that's great. And now for our listeners that want to hear more from you and your journey, where can they follow you?
Well, I think the easiest way is just check up on my Twitter site, because I'm always posting things on Twitter at Vic Lombardi. I always have links to whatever interviews and podcasts I may do. And I've been bad about the podcasts. I haven't done as many as I did right off the bat, but I usually like to feature people who have experienced prostate cancer, my fellow survivors, because we're all different, right? Again, and that's what makes this such a unique disease and diagnosis, is that one prostate cancer patient is completely different than another. You might be the same age, you might have the same Gleason score, you might have the same PSA level, and yet my cancer is so far different than yours. So I like to talk to different people, how they treat it, how they approach it, what their strategy is. And I think that's important because other people, some people are much more proactive than others, and I think it's important for people to hear that.
Yeah. Well, any final thoughts or words of wisdom today for our podcast listeners?
Well, the only final thought is I'm sure some of you in this realm may have heard about that new PSMA test that finally became FDA approved. And I think we're making some serious inroads. I keep an eye on all that stuff that happens, because the more testing, the more availability of that stuff, the better, because you have to have access. If I didn't have a test, I'd be carrying around a very aggressive cancer in my system right now that may have already gone to other parts of my body. So the fact that we are adapting new tests and making them readily available to patients is awesome. We are slowly but surely getting our arms around this disease, and I'm thankful to see that happen.
Well, I know I can speak on behalf of all of our podcast listeners today that we're very appreciative for you coming on the show today and sharing your story, and definitely very valuable information, which will help empower many men and their loved ones that listen to the podcast. So thanks again.
Doctor, and again, thank you for taking the time to do this, not only seeing patients, but educating patients. Thanks again.
Yeah, thank you. Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/prostate health podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.